Mrs. Karen DeMontbriand.
Yes.
Hi, my name's Vince.
Hi. Nice to
I've been
meet you.
assigned as your nutritionist. A little history about me before we get started. I've been a personal trainer for 10 years. I've also been in the Air Force as my unit fitness program manager, as well as a fitness training leader. Where I helped my squadron achieve a 98% approval rating and lower the fitness failure rates from 38% to 18%. I have a degree in nutrition, science of nutrition. I'm also certified through the Cooper Institute to train law enforcement and first responders in their fitness. My current field is human nutrition, and that's a little bit about me. So what brings you into the office and how can I help you?
Well, I changed my diet 2, 3 weeks ago. Trying to get lose a little weight and make sure I stay healthy. And since I've changed my diet, I found that my stomach started hurting a little bit.
Okay. I've gone over your charts, and your doctor was kind enough to send me some blood work as well. What kind of pains have you been having?
It's right in this area. It's not all the time. It's usually, well, I say usually, it doesn't happen very often, but it happens right after I eat. Sometimes it's like a sharp pain in the stomach area.
Okay. Do you think it's possible acid reflux? Is it has your ulcer come back at all?
I don't know. It's been a long time since I had an ulcer. I have been under a lot of stress at work lately. It is possible that it's an ulcer, I guess.
Does it feel the same?
I don't remember exactly how it felt, but I know it's in the same area.
Okay. Okay. So after you eat, is it right away? A couple hours?
No, it's pretty close to after right away.
Okay. So have you changed your diet at all?
Yeah, I've changed it well, not significantly. I always ate reasonably healthy, but I've cut out all sugar. I have a sweet tooth, so I cut that out, and I've also cut out wheat. Pretty
Okay.
much. I eat sprouted wheat bread sometimes, but not daily.
Okay.
But I don't eat any other wheat.
So you cut out some wheat and quite a bit of your sugar.
Yeah, pretty
Candies.
much all I don't have any candy now.
Okay. And your stomach still hurts afterwards.
Yeah, even when I eat just regular food.
Has there been, have you increased anything in your diet, such as
I'm eating a lot more protein
Okay.
than I used to. I was a vegetarian for quite a number of years, and so I'm not used to eating a lot of meat. But the program that I'm following calls for a lot of protein, so I've been eating a lot more animal products than I used to.
Okay. So you increased your protein intake. Have you also increased your green leafy vegetables at all?
I ate salads pretty regularly, and I love broccoli and cabbage and green vegetables. So I'm still eating. I probably eat a little bit more than I was.
Okay.
Because I've cut out the bread. I'm not eating so many sandwiches and things. I'm eating more meat and vegetables. So.
Okay. What about any starchy vegetables such as potatoes or any rice? Have you increased that?
No,
or?
I haven't increased it. I've probably decreased it a little bit. I don't eat a lot of those things anyway.
Okay. Well, what I can understand is you've increased your animal product intake, and basically you're eating meats, deli meats, eggs as well. Okay, and you haven't eaten those in the past quite a bit? Or?
I'm not really fond of eggs.
Understood.
And so yeah, it's been hard to check those. I did fill out a food diary
Oh,
like you requested. So there's 3 days worth of examples of what I'm eating.
okay. What a quick glance. This is remarkable. Very good. Matter of fact, this is better than most people's diets. Did you come up with this yourself, or was
No,
it?
I'm following a plan. It's from Beyond Diet,
Okay.
and it's kind of, it's not counting calories or anything like that, but it's based around it's kind of paleo and getting away from processed foods and sugars.
Okay. And how much water are you drinking?
At least 100 ounces a day, probably.
That's really good. Really good. I commend you on keeping up with a healthy lifestyle. Well, what I'm going to give you right here is some literature on some food combinations. It's possible that some of the foods that you're eating together do not agree with each other. So what I'm going to do is have you look at that,
Okay.
take it home with you, and just go over it.
Okay.
Also, you said you had okay. Okay. Well, I'm also going to give you right here some more literature on some of the foods that I see that's on your profile, on some foods to avoid, and maybe this can help with some of the acid reflux. For example, gluten. You pretty much want to stay away from gluten, which is found in the wheat, barley, rye, and oats. Okay, and what gluten is a indigestible protein that wears down the lining of your intestines, making it hard for your body to absorb nutrients. Oils. Do you have any carbonated beverages
No, I
whatsoever?
don't drink
Okay,
anything.
because that makes it hard for your food to digest. Deli meats. When you have your deli meats, it looks like you have some turkey here.
Yes.
Make sure that it is uncured.
Yeah, I usually get the ones without the nitrates, and
Oh,
um,
great.
I try and get organic where I can, but expense-wise, I can't do everything organic.
Right, don't break yourself if
Yeah.
it's gonna. Okay, well done red meats, and the reason why we don't eat well done red meats is because it contains a nasty thing called heterocyclic amines, and that's very carcinogenic. It means it causes cancer.
I don't eat a lot of red meat at all.
Okay, so we'll probably stick to about maybe 3 ounces, which is about a card deck, if you're going to have any red meat.
Yeah.
Usually have meat to complement a plant-based diet. I'm not saying vegetarian, plant-based. Simple carbs, try to limit those as much as possible. Doesn't look like you eat any fried foods.
No.
The skins of baked potatoes, yams, and sweet potatoes. If you're gonna eat those, make sure you boil them first, then you bake them. Vinegar, it's a little bit hard on the system.
Even the apple cider vinegar?
You might want to limit that to maybe start off with a teaspoon and see how that affects your body.
Because I use that in my salad dressing.
Okay, it might be very acidic too, so try to use a little bit less, have more flavor of the foods. Doesn't look like you have any caffeine, do you?
No, I don't drink coffee or tea.
Okay, because just high amounts, a little bit's okay. It'll get your cortisol levels up and kind of rev you up a little bit and leach a little bit of the calcium out of your body. So just small amounts if you need. Foods high in phosphate, make sure you read your ingredient levels. Sweeteners, all sugars, and although salt is good for your body, anything cooked in extra salt and extra sodium, high sodium, stay away from those.
I just use sea salt when I cook myself. I'm not eating any processed foods currently.
Great. That is awesome. So, what we're going to do is I want you to follow this list as best you can. Usually it takes about 2 weeks to embrace it, and another 2 weeks just to, okay, we can do this. I can do this. So let me sum up a little bit about how your diet is going. Oh, have you lost weight on this diet?
Yeah, I've lost about 7 pounds so far.
7 pounds? Was that
in 3 weeks?
3 weeks? Great. That is awesome. You lost 7 pounds, 3 weeks from a diet. Are you still feeling hungry?
I was feeling hungry between meals, but that seems to have eased off now.
Okay.
So I guess my stomach shrunk a little bit.
Just haven't had the cravings and.
No, I really haven't craved any of the candy or anything I used to eat.
Okay.
So that's been good.
Do you mind if I keep this?
No, go ahead.
Okay. One of the things I've also seen in your chart is that you take an omega-3.
Yes.
Okay. The fish oil.
Yes.
What kind is that one? What, you know the brand name?
I don't know. I know it's Norwegian.
Okay.
That's all I know.
Okay. One thing about supplements, especially with fish oil, that can upset your stomach. Are you taking that during the day, nighttime?
I usually, if I remember to take it, I'm taking it in the morning.
Okay. Have you noticed any stomach pains after you take it?
No.
On the days that you take it?
Mm-hmm.
Okay. And one thing with the supplements, when you're eating your food, you may not get all your supplements. So I notice you're only taking one, and there's 90 other essential nutrients that you must get. And that's on here too. Now, for your entire day, everybody in the world needs these essential nutrients. You need, your 91 essential nutrients. You have 60 essential minerals, 16 essential vitamins, 12 essential amino acids, and your 3 fatty acids. So you have this one omega-3, and you got a whole plethora of other essential nutrients. So I'm not going to prescribe anything right now. I just want you to, again, embrace it, look at it. Then the next time I see you, we might implement that. Also, I noticed you didn't write anything down for your exercise routine. Do you exercise?
Not at the moment. I'm not exercising at the moment.
Okay. Any reason?
You just don't seem to have a lot of time or motivation right now.
Okay. Is that due to the stress?
Maybe. I don't know. I say I'm not really motivated. I'm not missing it right now. I have exercised quite heavily in the past, but.
Okay. So what made you stop, or
I don't
change
know.
your routine?
I don't know. I just found myself not. I had an injury actually. It stopped when I was in the gym just about every day and working out hard. I had an injury that stopped me for a while, and I guess I never really got back into it after that.
Okay. All right. What if I can come up with a 15 to 30-minute regiment for you to do each day?
Every day?
Well, most days. Let's start off with maybe 3 days a week.
Think about it.
Okay. Well, at least you can think about it, you know. At least you didn't say no for me. Because I do have that accomplishment of having people succeed as long as they follow my plan. All right. Looks like we have everything for you, but it looks like it's also been a while since we've got your any measurements on you and the other profile. Well, I got your blood work. Had your doctor gone over your blood work and explained everything and what it means?
Yeah, pretty much.
Okay. Do you mind if I get your height, weight, blood pressure?
Sure.
You mind?
No, I don't.
Okay, if you don't mind. Alrighty. Would you care to have a witness
No, that's
in the room?
fine.
Okay. All right. What we're going to do is get your blood pressure first. Have you eaten anything in the past 30 minutes?
No.
Okay. When's the last time you ate?
It's probably been 2 or 3 hours.
Okay. All right. I'm going to get your pulse here. I need your left arm there. It's here. All right. Place across your heart. I'm going to monitor it. Notes here. Oh, no, sorry.
I heard it beeping. I thought maybe it was done.
No, not yet. Nope, keep it across your heart. Now, this is just an estimation of what your systolic and diastolic. So, keep it across your heart. It should beep at the end.
I feel it's relaxed. It says error.
Oh, okay.
I'll do it.
We'll have to do this again. I think you stopped it a little bit there. Keep it across your heart. Relax. Okay. That is really remarkable. 106 over 71, and your pulse is 59. Were you meditating before we started?
No.
Glad you're not nervous. Okay. I'm going to put this in a computer here, and what this is going to do is once I put it in here, in the computer system, it's also going to put all your blood work together too, so we can make a copy and you can take a copy of the home. Okay. Okay, let's go ahead and let's get your weight. And what this scale is also going to do is get your body fat as well. Again, it's just an estimation for your body fat. It's not 100% accurate because there's no scale in the world that's 100% accurate. Okay, go ahead and step on the scale for me. There you go. All right. And 242. All right. We're going to also get a hip and waist measurement as well. Okay. Everything has gone digital. So, you find your hip for me and place this around. Okay. Now when you come see me next time, I want you to wear this similar type of clothing, okay? Very loose. There we go. We're going to do this 2 more times. No, right on there. Right there. One more time around your hips. Good. Got the same number. Okay. So get the same number at least twice. We are good. If we get this different numbers, we do it a 3rd time. Okay. Let's put this around your waist. Okay. All right. There we go. Okay, one more time. Hopefully one more time. If we get this same number, we'll just document it. We'll just keep it the same. That's why I love going digital. Oh, good. Same number. Great. All right, let's punch this numbers in. All right. All right. So what we got here, BMI is extremely high for right now, 38.3, and that is in the obese category. That is a risk factor for cardiovascular disease, hypertension, and also diabetes. But looking at your blood work, and I'm sure your doctor said everything is in the normal range. This is very, you know, I don't have too much of concern with your BMI being high because it's an estimation, but because of your numbers look great. So your diet before must have been really good, and your diet now is extremely good because even here are your liver enzymes, and they are in the normal range, a little bit high, maybe because there's a little bit of stress on the liver, but other than that, it's in range. It's normal. And the other one I'm looking at is your LDL. Let's see if I can find that one there. I saw that one. There you are. Your lipid panel. Total cholesterol, 185. Your triglycerides, 120. Well, your HDL is really good. It's 54. And your bad cholesterol, it's a little bit high. It's 131. And if we can get you to start exercising, your HDL is going to go up a little bit higher, and your LDL is going to come down. But other than that, it's still in the healthy range. Okay. So, sum up, try to go through the literature, see what food combinations are possibly not agreeing with you, so maybe your pains will go away, and that's the primary thing that we're going to worry about or take care of is that pain. So I do have a card here. I want you to call me if there's any changes, any pains, any more pains, or if you have any questions.
Okay.
Numbers on there, email, I'll respond to you right away.
Okay. All right.
And remember, or let's sum up on 91 essential nutrients, food combinations. One thing that I'd also like for you to do is try to get those your breakfast, lunch, and dinner maybe a couple times out of the week. Have that the same. So that way we can understand if there's a certain food that is hurting your stomach. Okay? Can you handle that one?
Yeah.
Okay. And you're willing to try that? All right. Well, thank you very much.
Okay.
I'll see you in 4 weeks, and we'll see what great progress you've made, because it looks like when you lost that weight, we got that baseline, so we'll see some more good things from you.
Okay. All right.
Thank you for coming.
Thank you.